All right, let's dive in. If you're prepping for your medical exams, you know blood vessels are a huge topic. So this is your high-yield, no-fluff guide to really mastering the vascular system. We're going to build a rock-solid foundation so you can crush those exam questions with total confidence. Let's get to it. So first up, let's start with a question to get us thinking clinically. You've got three of the biggest killers in medicine, right? Atherosclerosis, aneurysms, and hypertension. Now, they seem pretty different on the surface, but what is the one fundamental thing that ties them all together?
Well, the answer is actually surprisingly simple, and it's exactly where we're going to start. The common link is hidden deep inside the structure of the blood vessel wall itself. If you can understand this wall, you're on your way to mastering vascular pathology. So let's build that foundation right now. You know, every single major blood vessel, from the gigantic aorta all the way down to a tiny arteriole, is built on the same three-layered plan. This is absolutely non-negotiable stuff you've got to know. Okay, starting from the inside out, the layer that's actually touching the blood, that's the tunica intima. It's this really delicate single layer of endothelial cells. And here it is, our first critical clinical link. This layer is ground zero for atherosclerosis. And hey, for some extra exam points, don't forget it also has those Weibel-Palade bodies, you know, the storage units for von Willebrand factor. Moving one layer out, we hit the powerhouse, the tunica media. This is the muscle on the elastic layer. It's what's responsible for squeezing and relaxing the vessel, vasoconstriction and vasodilation, which is how we control blood pressure. A huge pathology connection here is Marfan syndrome, where a defect makes this layer weak, putting patients at risk for a life-threatening aortic dissection.
And the outermost layer? That's the tunica adventitia. Just think of it like supportive scaffolding, made of tough connective tissue. Its superstar feature, though, is the vasa vasorum, which literally means the vessels of the vessels, and it's a network of tiny vessels that supplies blood to the outer wall of big arteries. Classic exam question right here. In tertiary syphilis, these little guys get inflamed, which starves the aortic wall and can lead to a nasty aneurysm. So how in the world do you remember this sequence for your exam? It's simple. From the inside where the blood is, moving outward, just think IMA. Intima, media, adventitia. Easy, lock that one in.
Okay, we've totally mastered the wall. Now let's see how this basic three-layer blueprint gets modified to create the different players in our circulatory system: arteries, veins, and of course, capillaries.
This table just lays it all out perfectly. You see, arteries have these thick, muscular walls to handle all that high pressure. Veins, on the other hand, have thin walls and wide lumens, so they act as a volume reservoir. In fact, they hold about 2/3 of all your blood at any given moment. And capillaries? Well, they're stripped down to just a single cell thick for one job and one job only: super efficient exchange.
But look, if you're crunched for time, here is the absolute #1 high-yield exam differentiator. Just remember this: arteries are all about that thick tunica media, built to handle crazy high pressure. Veins are all about their valves, which are crucial for stopping low-pressure blood from flowing backwards, especially in your leg. All right, now let's connect all this anatomy to the actual physics of blood flow. This part on hemodynamics, trust me, it's a goldmine for classic physiology questions.
Meet Poiseuille's law. I know, it looks a little intimidating, but the only thing you really need to care about here is the relationship between resistance and radius. Resistance is inversely proportional to the radius to the 4th power. This is not a simple one-to-one relationship, it's exponential. And it is the entire secret to how our body fine-tunes blood pressure second by second.
Let's actually see this in action. So here we have a small arteriole, right? It's got a normal radius and its corresponding level of resistance. This is our baseline. Now watch this. If we just cut that radius in half, a really tiny change, the resistance doesn't just double or even quadruple. No way. It skyrockets by a factor of 16. This is exactly why those tiny arterioles are called the resistance vessels and why they're the main players in controlling blood pressure. A little bit of squeeze there has a massive impact everywhere else.
And that whole concept of resistance, well, it leads us straight into pathology. This is what happens when these beautifully designed vessels start to break down. So first, let's clear up something that confuses a lot of people: hardening of the arteries, or arteriosclerosis. It actually comes in 3 different flavors. You've got atherosclerosis, which is plaque in the intima. Then there's Monckeberg's, which is a benign calcification of the media. And finally, arteriolosclerosis, which is the hardening of the smallest arterioles, usually because of hypertension and diabetes.
Now let's look at a true emergency. Aortic dissection. See how it connects everything we've talked about? A tear starts in the intima. Then blood rips its way into that weakened media, creating a false channel. And what's the #1 risk factor? Chronic high pressure, hypertension. The classic sign you'll see on a chest x-ray is a widened mediastinum.
Okay, we have covered a ton of ground, so let's boil it all down into a final exam blueprint. These are the absolute must-know points.
Here it is, your 5-point checklist. Number 1, the wall is IMA. 2, arterioles control total peripheral resistance. 3, atherosclerosis is an intimal disease. 4, the aorta's elasticity is what gives us the Windkessel effect, which maintains our diastolic pressure. And 5, veins are capacitance vessels. They hold most of the blood. All right, time for a classic multiple-choice question trap that examiners just love to use. Of the 3 types of arteriosclerosis we just talked about, which one involves hardening of the artery but does not actually make the lumen any smaller? The answer is Munckersberg sclerosis. Why? Because the calcification is stuck in the tunica media, it doesn't actually push into the lumen where the blood flows. It makes the artery feel stiff, kind of like a pipe stem, but the blood flow isn't blocked. It's an awesome question to test if you really know where the pathology is happening. And here it is, the entire journey, all in one single view. This is your final mental anchor. It all connects, from the high-pressure arteries to the resistance-controlling arterioles, through that delicate exchange at the capillaries, and finally, all the way back to the heart through the low-pressure, high-capacity venous system. If you understand this flow, you understand the very core of vascular physiology.